Thank y'all for joining me on another BirthMama Speaks. Fire up an incense, and we're just gonna dive into it. I appreciate y'all so much for being with me on this journey. Um, my goal is just to share a little bit of knowledge, right? I got this 9-part series. This is the third one. Yeah, let's just do it, right? So tonight I want to build with everyone on some of the pregnancy myths. My goal is to dispel some of the myths. A lot of things, a lot of symptoms show up in pregnancy that we just claim as being normal. And a lot of times I want to just make it clear that a lot of these symptoms aren't necessarily not normal, though they're common. And I give the example all the time, like, for example, headaches. And we're going to talk about that a little bit in pregnancy as well. But headaches for anybody, pregnant or not, a lot of times we look at headaches as being a normal occurrence. We just pop a Advil or Tylenol or ibuprofen. And even though these things are common, they really aren't normal. And so a lot of ailments in pregnancy just gets discredited, I think, because yeah, they are so common, but they're really abnormal. So here we go. Oh, hey, I got some YouTubers. All right, let's make it great. Okay, so let's first dispel the myth about eating for two, right? A lot of times in pregnancy, we think that we're supposed to be eating for two, and that can't be further from the truth, right? So, really, in pregnancy, a healthy weight gain would be ideally 1 pound a week, and that's if you're starting out your pregnancy at your normal uh, body mass index or BMI, right? So, me, I always say I'm 5'2". By my normal pregnancy BMI, they say it's supposed to be about 125, 130 pounds, right? I always say, as a Black woman, you got to give an extra 10 pounds for hips and thighs. We built a little different, but even with that, it should be about 140 pounds for myself, no more than 140, 135, 140. So that would be my body mass index, right? Normal for me. Anything over that can be considered hey, I love the hearts. Anything over that can be considered too much, right? So that 40 pounds you have to add, you would probably take away, let's say for instance, I'm 5'2" and I weighed 160 pounds. Well, I'm already about 20 pounds in starting that pregnancy. So in that case, I really should only gain about 20 pounds in my pregnancy, right? So as you can see, that eating for two ideology um, is not, it doesn't work for me, right? It wouldn't be ideal for a person that's 140 pounds, 160 pounds to gain 40 pounds, because that would put me at 200 pounds, which would be over my body mass index and too much for my pregnancy. That would be considered an unhealthy pregnancy weight gain, right? So ideally, eating for two is not necessarily the case in a situation like that. It would be way too much, right? So, another thing that comes up in pregnancy is nausea. That's a big one. Nausea, a lot of people experience pregnancy nausea, and that can cause a lot of issues um, with just poor blood volumes, with weight gain, with having a baby that's too small. It can cause a lot of additional issues when when you just can't keep food down, right? Pregnancy nausea is totally not a good thing. A lot of women experience it, and the reason for the pregnancy nausea in many cases is the excess hormones that our bodies are, building up in order to sustain this healthy pregnancy, right? And so that nausea, there's a fine line between nausea and then profuse vomiting, which would be hyperemesis. That is a whole nother beast in pregnancy that we're not even really going to dive into in this short uh, video, right? The goal is just to go down the list of other things that can show up, but definitely pregnancy nausea can be controlled and curtailed with just introducing some extra water into your diet, for one, to help flush out and thin out some of those excess hormones. Also, dandelion herbal tea can be very helpful in flushing out the liver. Dandelion herbal tea is safe for pregnancy. It's also safe for breastfeeding. So ingesting dandelion herbal tea can really help curtail some of that pregnancy nausea that a lot of times people feel. um, and then it's ultimately figuring out what is your cause, right? Because everybody that has pregnancy nausea is not always stimulated by the same thing. It's, yes, it is triggered by the slow digestion, which is triggered by the excess hormones, the pregnancy hormones. But what actually is your trigger is what you want to find out. Now, I've had some families that have had great results, believe it or not, from just using edibles, candle butter, right? I know it's argumentative. However, as we know, cannabis is growing in awareness throughout, in legality rather, not so much awareness, but it's growing in legality throughout the country. And one of the medicinal uses is helping to curtail nausea. And so, in an edible form, I can appreciate an edible form. And if you choose to use that source, I always say know your grower, right? You really want to be as close to your grower as possible, um, or know your source. Find if you can see if you can find you some nice organic something out there. But edibles can help suppress the nausea long enough for a person to actually eat and hold food down. And again, this is not necessarily hyperemesis. That's a whole nother beast, like I mentioned. But ultimately, we're just talking about normal pregnancy nausea that people experience sometimes in that first trimester leading into the second trimester. But that can be highly effective. So, like I said, dandelion cannabis is another one, and increasing your water can really help to minimize some of that nausea that people experience. And if you're just joining in, my goal tonight on BirthMama Speaks is just to dispel some of the myths. There's a lot of symptoms that women deal with in pregnancy that are just dismissed as, oh, that's just normal. You just pregnant. That's just what it is. But ultimately, not always. Sometimes those symptoms are rooted in more issues, which is some of the things the goal is to talk about, and just understanding the difference between what's normal and what's not, right? So, like I said, nausea, hyperemesis, that's the dandelion, the candle butter, or the and water can really help suppress some of that pregnancy nausea. And also the same for spitting. Some women deal with the spitting in pregnancy. That's, some women have that need to they have this overproduction. Their glands, the salivary glands, are overproducing, right? And again, that's another side effect of the hormones. And sometimes pregnant mamas can be walking around with a spit cup, right? And they just constantly spitting, or a bottle that they're using to constantly spit with. Again, I bring it back to dandelion. Dandelion is like an amazing herb that's grows in the springtime all around Georgia, right? A little yellow, beautiful flower, but it is a highly medicinal plant. And again, it's safe for pregnancy and for breastfeeding. If you choose to consume any herb, I always encourage you to take it to bowel tolerance, right? Because most herbs is going to make you go. They flush you out. That's what they do, right? But dandelion can be very helpful in alleviating a lot of pregnancy symptoms because it targets the liver and the blood. It's a gentle cleanser. So it helps to flush out some of those excess hormones, right? So for the excess spitting, sometimes dandelion can be very helpful with that as well. And again, increasing your water. Again, the goal is to thin out some of those hormones, flush them out your system, and ultimately helping you to process them better, right? Let's see, another one that shows up for me quite often for my families is headaches. Headaches can be very common in pregnancy, but they are always discussion worthy, right? Never just dismiss a headache. Even if you're not pregnant or expecting, never just dismiss a headache. Headaches are a clear and clean sign that your body is trying to manage some type of issue, some type of discomfort, right? Something that's going on in the body. So it's a good idea to always honor a headache. Check in with yourself and find out what's really going on. So there again, in pregnancy, it can certainly be related to the hormones. Once again, thank you for the hearts, love. But it could definitely be the hormones. But then every prenatal, I like to ask my mamas, have you had a headache lately? Have you been experiencing a headache? It can be too much sugar. It could be too much salt. You may not have had enough rest. So you could be tired. You could be stressed. Where is the headache? Is it in the front of your head, in the back of the head? Is it in your temples? Is it behind your eyes? Understanding where the headache shows up in your body can also help you identify exactly what the cause is. So increase in your water, sometimes dehydration can be the reason why you have headaches, but you should always honor it, because the headache can be something more pressing and underlying. Just through that Q&A of asking a mom, when did you start having headaches? What did you do that day? Did you eat? Well, did you sleep? Did you what was your water intake? Just a Q&A a lot of times can help us get to the root cause of why they have headaches. Migraines can show up a little differently. Surprisingly, some women that deal with migraines throughout their life can be cured in their pregnancy. And I don't have the science to that one, but it is definitely a thing. Just like some people wear glasses and then they get pregnant and all of a sudden they don't need glasses, right? Similarly with migraines. But with migraines, just like with headaches, it's a Q&A, and sometimes just the excess hormones can trigger those migraines. So there again, there's my best friend dandelion. Dandelion shows up again. And when we're talking about dandelion, I'm talking about the root or the leaf, right? Not so much the flower. I honestly don't know I don't even know if you can buy dandelion flower, right? But I know you can buy the leaf and the root, and both of them are equally effective for dealing with all the things that I mentioned. We're helping to flush out those hormones in your body and helping to alleviate some of those pregnancy symptoms, right? So, and dandelion is actually quite easy to find now. Despite online, of course, Amazon all day, but a lot of times even grocery stores like Walmart now even carries dandelion. But let's just keep it running. So dizziness is something else to be concerned about that can show up in pregnancy, right? Some people do deal with what do you call that? Dizziness, vertigo in pregnancy, right? Not too much to alleviate that one. Sometimes just the extra fluid volumes in your body can throw off your equilibrium in your headspace and can cause vertigo. There again, dandelion can be effective. It also works as a diuretic. It has a diuretic effect in the body, so it can help to pull off excess fluids. You're going to hear me say dandelion a lot. Like, that is my miracle herb in pregnancy because it is pregnancy safe and it's breastfeeding friendly as well. And it alleviates so many different things. A lot of times just by targeting, flushing out that liver. Like I said, dandelion does help to give a gentle cleanse to the liver and the blood. So it can really help with so many different things. So we were talking about fatigue, not fatigue, I'm sorry. What did I say? Dandelion for vertigo, right? So it can be not always a quick fix with that one because vertigo, it just depends on the person. But it can, if the reason for your vertigo is the extra fluids that you build up in the body during pregnancy, it will help to alleviate excess fluid, and then it can help alleviate or bring a balance to some of that vertigo that sometimes women experience in pregnancy. So again, there's that dandelion. And then I said dizziness. If you're having headaches and dizziness, it is worthwhile to check in on your blood pressure. And so next week, I do intend to talk a bit in depth about blood pressures and some of the other more serious, like gestational diabetes and things like that, preeclampsia. But understanding what your normal blood pressure is critical, right? Because the norm that we look at, most of your providers are going to look at like 120/80 as the baseline for hypertension. But let's say, for instance, that your blood pressure hangs out around like 110/65. If you get up to 120 or 120 something over 80 something, then that can be excessive for you. And if you have those excessive numbers alongside dizziness, headaches, nausea, this could be some preeclampsia starting to settle into your body. So we're going to talk about that a lot in more detail next week. But tonight, I just wanted to skim the surface of some other ailments that you can be mindful of and how we can address them based on what's normal and what's not. So never undermine a headache. Moving on to the next one, forgetfulness, right? We call it pregnancy brain. Pregnancy brain is a real thing, right? Pregnancy brain, drink your water. Pregnancy brain actually is a result of the shrinkage of the neocortex, right? It is a tangible, real thing that I believe gets just undermined. People just like, oh, I got pregnancy brain, not really understanding where it stems from. There is residual shrinkage that happens in the neocortex during pregnancy. And I have done research upon research, but it's hard to really pin down exactly when the brain grows back to its full size. We know that that shrinkage remains for some time after pregnancy. So whether that's 3 months, 6 months, 1 year, sadly, I don't have the answer to that yet, but we know that it definitely does shrink. The max cap, what is it? The apex of the shrinkage is in the third trimester. So when a woman is forgetting things, it really is because when you we get later in your pregnancy, it's time for you just to settle down. It's time for you to just, I always like to say, birth is primal and don't nobody take it. This is the second time I have announced the title of my next book. Birth is primal. It is. Pregnancy is a primal process as well. And a lot of times we want to continue our day-to-day industrialized lifestyles, and it is not harmonious with pregnancy, right? And this is a big reason why we get so sick and we deal with so many of these ailments that we're talking about tonight, because the body really wants to just focus on growing this baby, right? Growing this beautiful baby, the brain, the lungs, the digestive system, the heart. It wants to focus on these things, and we're trying to continue our day-to-day life. And so the closer you get to birthing this baby, the more the body demands. That's why fatigue becomes even more prevalent in late pregnancy. Not only are you bigger, you're probably at least another 30, 40 pounds larger, but then you're also your brain is slowing down. It's not ready. It can't hardly multitask like it was doing pre-pregnancy. And after you have the baby, especially if you're breastfeeding, your body is releasing a lot of endorphin type hormones that just make you tired and make you want to sleep. And the more you fight that, the more is you become a catalyst, the more you become a candidate for postpartum depression, because you're warring against this vessel that is designed for you to just sit down, sleep, breastfeed, and eat for a substantial amount of time, months even. Remember, it took you months to grow this baby. You're not going to be ready to jump back into your lifestyle in 6 weeks. You're just not. Your body has not even healed properly, even though the 6 week time was put in place to mark uterine shrinkage, right? Your uterus should involute and go back home by 6 weeks. A lot of my mamas with home birth, a lot of times in 2 weeks, because they're breastfeeding, that uterus will shrink back down or involute, go back home, as I like to call it. But when you're trying to, just because you stop bleeding, just trying to jump back out there and go to work and just pick up with your old lifestyle, a lot of times you have a lot of misfires in your brain. Your brain is not wired for all of that just yet. And you find yourself forgetting a lot of things, making more mistakes. And just really, if you have a type A type personality, you're really going to be annoyed and aggravated with yourself, disappointing yourself. And now we have the perfect stage for postpartum depression, and in some cases, even worse, postpartum psychosis. So, the best thing you can do in your pregnancy, I always like to encourage folks, is to start developing your postpartum plan, building your support system for that postpartum. Right, birth should really be a family event. It takes a village, and these have become just idle sayings, but they carry great weight in that postpartum phase because all the things that I just mentioned. The more that you're able to just honor that time for yourself and rest, the better you'll be mentally. Your mental health will be that your mental health will be better, and so will your physical health. Your overall well-being will be better when you have the proper systems in place on that postpartum side. um, so remember all of those things. That's that forgetfulness, that's that brain shrinkage, as I mentioned. Let's keep it pushing, right? We talked about forgetfulness. We've talked about headaches and spitting and nausea and the myth of eating for two. We've covered all of those things. Um, Fatigue, right? Fatigue is a big one. Now, what is normal pregnancy fatigue? That can be a struggle to really identify, because a lot of times I've noticed for Black women specifically, because that's who I center in my services, Black families, is a lot of times that fatigue is rooted in poor blood volumes, anemia, right? So a lot of times when we get they'll say they're tired, they just don't feel like doing anything, and their providers in many of those cases will just say, "Oh, that's normal. It's normal to be tired in pregnancy." But when we look at their labs, we see that, oh, your hemoglobin or your hematocrit, your red blood cell count is actually very low, and you can use an iron supplement. And then once we get them on the proper supplement, they recover their energy levels and they feel a lot better. So don't always just discount fatigue in pregnancy as normal. And especially if you're dealing with nausea and vomiting, of course, you can imagine how that could be tied into fatigue because you can't keep down quality food. And so I also want to say, when I mention iron supplements or any kind of supplement, you always want to go with a plant-based or a whole food type of supplement. And the reason for that is we're dealing with the bioavailability of nutrients within that supplement. And it's just that just is a fancy term that just basically means how your body recognizes it as food or something synthetic. So when you're taking a chemical based supplement, your body doesn't recognize it. It's going to just push it out. You're going to excrete it either through your urine or your bowels. You're not going to hold on to it. You're not going to metabolize it. But when you're taking a plant-based supplement, and you don't have to be a vegan or a vegetarian to seek out a plant-based supplement, right? Your body will recognize it as food and you will absorb it, most of it. Otherwise, you're kind of just wasting money. And so really consider that with your prenatals. I've met many, countless families who will just run to Walmart, Target, even in some cases. And Target has some pretty decent stuff, but even still, Kroger, grocery store, pharmacy, or even take the prenatals that's prescribed to them through their physician. And I would argue not to take that, right? Go and invest in you a good quality supplement. If you taking an iron that was prescribed to you by your physician, if it's a ferrous sulfate based iron supplement, it's probably constipating you or giving you stomach upset. And even if it's not, it's a very synthetic form of iron, and you're not absorbing the max dosage of it. Like, you would do so much better on a plant-based iron supplement or prenatal vitamin. So that's one of those things you want to invest in. Pregnancy is an investment. Your baby is an investment, and your supplement is definitely one you want to find a good quality one. And so if anybody knows a good quality one, put it in the chat. Put it in the chat what a good quality pregnancy supplement would be. Floridex is a good quality. Yes, it is. One of the things about Floridex, it's only 25 milligrams of iron, which is fine if you're just taking it prophylactically, right? But if you actually are dealing with anemia, I have found with the families I've worked with that Floradex is subpar. They have to take an extra dose of it. We're trying to get you at least about 40 to between 40 to 80 milligrams of that iron daily, depending on how low their levels are. But you're absolutely right. Floradex is a good quality iron supplement. It's just very low in iron. However, if you're doing it prophylactically, or you just, like for instance, you get your labs back and they tell your hemoglobin is like a 10.1, something like that, then Floradex is a nice little cushion, 10 point something, 11.2, something like that. Then yeah, Floradex would be great for something like that. Um, Yep, Hemoplex. Hemoplex is my wonder drug, right? And I'm gonna talk about that one in more detail next week. But yes, Hemoplex is a great one. Please, I need a good quality prenatal vitamin. Not sure. Yeah, put in the chat, y'all. So I don't want to endorse anybody. I don't want to endorse. No, I haven't made it there yet, where I can get big bucks for giving shout outs for. I just gave one though. I'm lying, right? Hemoplex. I just gave one, but okay. What the heck? So what is that one? A lot of my vegan families, they tell me that what is that one? Garden of Life, my kind. That's a really good one that a lot of them take. And not only vegans, but they are the families that I find that really lift up that specific one. Garden of Life by Nature's Plus. No, Nature's Plus has one. Garden of Life is the name of it. Garden of Life, my kind. But yeah, put it in there if y'all know any that are good. Dry, itchy skin and dry, itchy scalp and hair loss. That's another big one that shows up in pregnancy. And believe it or not, that can really easily be resolved with good old fashioned water. Water can really help relieve itchy skin. And that depends. Now, if we're talking about the itchy skin that comes from one of the effects where you actually get a rash on your torso, that's something different. And then again, what's that herb I've been mentioning all night already? It can help with that rash as well. And it also can help with some other itchy skin irritations. Somebody put it in there. That's right. Drink up. Thank you. But man, I wish I had another book to give away. I do. I would give away another book. Somebody tell me the name of the herb that I have been talking about all night, and I'll give away another one of my books, When Birth Calls, right? So, what is the name of the herb that I have been saying? That's right. Somebody already put it in there. Who said that? Y'all are on it. Dandelion. Yes. Dandelion. Dandelion is very effective. I'm telling y'all, look it up. Pregnancy friendly. It cleanses the liver. It's a gentle cleanse on the liver, gentle cleanse on the blood. And it can be very effective for flushing out those excess hormones that can lead to some dry skin, loss of hair, because all of this is related to those hormones, right, in pregnancy. So if we flush out the hormones, then a lot of times the body can recover from all of those ailments. So if you're dealing with some of those things, the first thing you want to do is increase your water. My person in my chat on YouTube also said dandelion root. Yes, dandelion root is very helpful for hair, for dandelion root and the dandelion leaf. Either one of them can be very effective. So she says, can you touch on nettle? Nettle, oh yeah. So I really want to lift up. I'm gonna touch on it, right? Because nettle is my go-to for building up blood volumes. But you're absolutely right. Nettle is full of iron. It's really helpful. We're gonna really dive into some of those other herbs when I talk next week about blood volumes and some pregnancy hypertension and preeclampsia and things like that. But yes, nettle is another really good one, and it's safe for pregnancy. There's a tea blend called Nora, nettle, oat straw, red raspberry, and alfalfa. It was a tea blend that has been composed by midwives. I don't know exactly who originated it, but it is an awesome tea blend that can help you build your blood volumes in pregnancy. And that's so critical. You hear me say that a lot. Blood volumes is so critical for a safe pregnancy, safe birth, especially if we're talking about a home birth. It helps to restore the uterus, helps the uterus involute. We talked about that word earlier. Nora is just amazing. And nettle is one of those herbs that's in it. Also, oat straw, red raspberry, and alfalfa. So you can look that blend up and see and consider drinking it, right? It's suggested to start drinking it in your second trimester on forward throughout the remainder of your pregnancy. And while we're on the topic, I want to dispel this myth because this came up probably a couple of years ago. And it is growing in awareness about red raspberry. Please, please, please stop telling people and don't believe the hype that red raspberry induces labor. It does not. Red raspberry is not it is not an emmenagogue. It does not induce labor. Emmenagogues are pills or herbs that cause your uterus to contract. Red raspberry does not do that. It helps to build and restore the uterine lining. So when you do have contractions, it will cause for more effective contractions. What you said, Mama? Nettle, oat straw, red raspberry, and alfalfa, a midwife's must. Yes, say that. It will help to build and restore the uterine lining. That's what red raspberry does. I've had so many people come to me and so many clients that don't want to take the Nora because they say, well, won't that induce labor? No, I don't know where that rumor started, but it's not true. It is not an emmenagogue, right? It is not like pennyroyal or tansy or some of these other herbs that midwives can lean into to help induce labor. Not red raspberry. Red raspberry causes for more effective contractions once your uterus starts to contract, right? So you can take it during the labor for that reason, but it's not an inducer. It's not going to put you in labor. Okay, just wanted to clear the air on that one because I'm so, yeah, that one right there is, I have no idea where it came from. So we talked about dry, itchy skin, scalp, and hair loss, toothaches and gum problems, right? So pregnancy really pulls on the calcium. So the building blocks of a healthy pregnancy, we're looking at calcium, protein, and iron, and of course your water, right? Calcium is needed to help build the nerves and the bones of your baby. And so if your body doesn't have enough calcium, it's going to start pulling from your bones to give to this baby. It's going to pull from your reserves. And so that can leave you having some oral issues, right? Gum disease or gum, bleeding gums, and as well as people lose teeth in pregnancy when you're calcium deficient. So it's very important that you are mindful of taking in calcium to have to have enough for yourself and for your baby. So that's one of the best ways to curtail the toothaches and pains. Of course, go to the dentist. In all insurance covered dental care in pregnancy. And so it's gonna, your dentist, your orthodontist or whatnot, they're the ones that really need to assess what's going on. Do you have a cavity? Do you need a root canal? What's really going on in your mouth? But this is why one of the reasons why pregnancy will cause those unforeseen issues to flare up in when you get pregnant, because your baby is pulling your calcium reserves. So you want to make sure that your prenatal has a sufficient amount of calcium in it so that you don't have those issues. So calcium, yes, is a big one that you want to look at for curtailing any kind of tooth or gum issues, right? Peroxide is a big one for me. For oral hygiene, you can use peroxide to help, and also coconut oil. Coconut oil pulling. Now, I will tell you what you got to say on that, Mama. Gum care is so important. Gum disease affects yes, that's right, Mama, because if you can have an infection in your mouth that leaches into your blood supply and cause miscarriages. And this is one of the reasons why your insurance will cover oral dental care, is to help because it helps prevent miscarriages. So peroxide, again, bringing it back to that, it helps to pull germs from the mouth, as well as coconut oil. Coconut oil, we know, is to be an antifungal and an antibacterial, similar to your peroxide. It's going to pull a lot of those toxins from your mouth, don't swallow it. You swish it. So you put it in your mouth, swish it around, and then you spit it out. Hold it for as long as you can and spit it out. Now, we'll say this about coconut oil because it's also considered oil pulling. It will release that rotten tooth. If you got a rotten tooth, that coconut oil, and you keep using it, it's going to release that rotten tooth from your mouth. So you might want to check on that when you start using it if you intend to keep that tooth. But think about it. If the tooth is rotten, it needs to go anyway. So pregnancy also increases the bacteria that grows in the mouth. This is true. Y'all be dropping jewels in here. Mama said be sure to get them x-rays, using your dental x-rays. I love it. Y'all better listen to the great ones. IG, tell them. So toothaches, gum disease, all the jewels. I love it. Moving forward, we got 10 minutes. Let's talk about some of the other common things that we see in pregnancy is UTIs, urinary tract infections, that is, right? Another thing that they say is common, but it doesn't have to be, right? Common, but not normal. That's the goal tonight, to talk about these ailments in pregnancy that are very common, but they're not normal. They shouldn't be looked at as just normal and dismissed as a normal pregnancy thing. And so some people have reoccurring urinary tract infections in pregnancy. Again, it goes back to the hormones. So many of these things can be curtailed with water. Good old-fashioned water. That's why I'm drinking it tonight, to just help encourage and remind everybody to drink your water, because it will help flush your kidneys out and help flush out any of those extra hormones that can lead to the UTIs. And so water, again, and what's my favorite herb? Dandelion. Dandelion, and then cranberry juice is really good as well for those UTIs. But ultimately, prevention is the key when it comes to your UTIs. You want to really be mindful of what you're drinking, right? My coffee drinkers out there, my soda drinkers, hopefully Kool-Aid just needs to stop. If you're drinking Kool-Aid, and if you're over 20 and you drinking Kool-Aid, you just need to look at yourself in the mirror. Take a hard look at yourself in the mirror and say, why? Kool-Aid is for kids. That's what the commercial used to say when I was a child. Kool-Aid is for kids. It is not for adults. Put it down. Do not drink Kool-Aid, okay? Let it go. Sodas is not your friend either, right? Especially if you're doing caffeinated sodas. So you really want to curtail and limit your intake of a lot of these things, and it can help limit and prevent urinary tract infections. Because the moms that I've had, the very few that will have reoccurring urinary tract infections, is usually centered in the amount of carbonated beverages that they take in. They have an aversion to water. They don't like water, and they drink a lot of juice, sodas, and teas. And that's not healthy for your kidneys, pregnant or not. So again, that dandelion can help flush out some of those extra hormones and help alleviate those things, right? So increasing your water is key. And then that back pain was another one, the last one I have on my list. That can actually be associated with the UTIs. So if you find yourself having frequent urination, you're constantly thirsty, and then you're also having back pain, it can be hard to decipher when you're pregnant. Is this normal? Because I got all this weight on my bladder, so I'm going to be peeing a lot anyway. And then all this weight can cause back pain. So having your physician or your midwife, this is why we check your urine. We're checking for things like that. We're checking your urine with the dipstick to see if you potentially have elevated amount of leukocytes, white blood cells in your urine that can be an indicator for urinary tract infection. But the only way to really know 100% is if you go and get it tested at a lab or through your doctor, through a physician. So back pain shouldn't be undermined either. Back pain, round ligament pain, those things can be alleviated with wearing a belly band, right? So if you have one of these bellies that just kind of hang in the front and it's causing sciatic nerve pain to run down the back of your leg, you're having aches and pains around the front, the groin area, your pubic bone is very achy, your lower back, I would suggest seeing a chiropractor. Chiropractors are phenomenal for helping to alleviate some of those discomforts. And then a belly band. Get you a really good support band, a belly band, and it can really help to lift that baby up off of your bladder and prevent some of that lower back pain that you're having, some of that sciatic. A lot of those issues can be resolved with wearing a support belly band. All right. I ran off a lot of different things to you all tonight, and I'm so grateful that you walked through with me. Belly band, I'm sorry. Eating for two, nausea, spitting, headaches, forgetfulness, swelling, fatigue, dry, itchy, scalp and skin, hair loss, toothaches, UTIs, and back pain. And also, one last thing I'm going to close out with is normal discharge, right? Discharge in pregnancy. Now, the later pregnancy that you get in that third trimester, you might start seeing an excessive amount of discharge, especially the closer you get to like 37, 38, 39 weeks. As long as that discharge is clear and it's not itching you and it doesn't have an odor, it's normal. Any other thing outside of that, itchy, you see a color to it, like a white frothy color to it, or yellowish or greenish tinge to it, or if you see, or if it has an odor to it, those things can be something else. It could be something else going on, like bacteria vaginosis or candida yeast infection, something like that. But that is normal to have, specifically in later pregnancy, some kind of discharge. All right. So I appreciate all of you hanging in there with me, sharing your time with me. Like I always like to say, you could have been anywhere else in this moment, but you decided to rock out and share that time with me. I value you as much as you value the information I shared here tonight. You know how to find me. You can DM me. You can message me on any of my platforms. I'm Love and Touch on all the platforms. Really just Instagram and Facebook, y'all. That's all I got. I don't have time for the other ones, but that's the best way to get me. This will be a 9-part series. This was the third one. And so my goal, if I'm not at a birth, is to do this again next week, Monday at 7:00. These recordings will be saved to YouTube, not on Instagram. So if you wanted to go back and revisit any of this information, you can find it on YouTube at Love and Touch. And other than that, everyone have a great evening. Remember to drink your water. Blessings.